Health and illness. Asking about health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as, what is your general health like? How's your health generally? If you are in good health, you are well and have no illness, disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. Not ill is the same to fit, healthy, fit and well, well, very well, in good health. Ill, unwell, unfit, unhealthy, not well, not very well, poorly, in poor health. Sickness. Sickness has a similar meaning to illness. It is also it is also used in the names of a few specific diseases, for example, sleeping sickness and trouble sickness. Patients also talk about sickness when they mean nausea and vomiting. And when patient says, I was sick this morning, possible meanings. I was ill this morning, I feel unwell this morning, I vomited this morning. When patient says, I feel sick, possible meanings. I feel ill, I feel unwell, I am nauseous, I feel the need to vomit. The combination sickness and diarrhea means vomiting and diarrhea. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a good, full, complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb get to talk about change. For example, get over an illness, to recover, get better, to improve, get worse, to deteriorate. If a patient is better but then gets worse again, the patient has relapsed. Relapse. Another word for improvement, especially in recurring conditions such as cancer, is remission. He got over the illness very quickly. 2 years later, she remains in complete remission. Parts of the body. 1. Parts of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English names even when talking to each other. There are a few exceptions when doctors use the anatomical names. Uh, these are shown in brackets below. Jaw, mandible, neck, shoulder, armpit, axilla, upper arm, elbow, back, buttock, wrist, thigh, calf, leg, chest, thorax, breast, stomach, tummy, abdomen, navel, umbilicus, hip, groin, inguinal region, knee, patella, kneecap, shin. Limb means arm, upper limb, or legs, or leg, lower limb. The trunk is the body, excluding the head and limbs, referring to parts of the body. When patients speak about their problems, they often refer to a part of the body. For example, I'm having trouble with my hip, shoulder, or neck or knee. The doctor often needs to ask about a part of the body. For example, do you get any pain in the chest, the stomach, or the back? Your chest, your stomach, or your back? Describing radiation of pain. A patient is telling the doctor about his back pain in the parts of the body. It radiates too. It starts in the back, then it seems to go into the right buttock and down the back of the right thigh to the knee.